Informed consent, what it is and why it's important. So informed consent is a discussion between a physician and a patient regarding a proposed treatment, and it helps the patient understand the treatment and make an educated decision whether they want the treatment or not. Physicians need to obtain consent anytime there's a long-term treatment for things such as cancer, discussion of HIPAA laws, specific procedures like surgery, blood transfusions, anesthesia, things like that. There are two types of consent. There's implied consent, which would be an unspoken understanding between the patient and the physician. And this is things like, will there be a scar, or things like that. Express consent is a verbal or written understanding between the patient and physician. Now, this would be the page that you would sign before you got the treatment. A patient also has the right to waive the disclosure of information, and it would also be a piece of paper that a physician would have them sign to protect them. So the physicians need to disclose the risks, possible complications, the benefits, the scope of treatment, alternatives to the treatment, and also what would happen if the patient refused the treatment altogether. The easiest person to obtain consent from is a competent adult. So this is anyone over the age of 18, and they have and they're declared competent to make an educated decision. The only reason that a competent adult could not give consent is if they were incapacitated. Now, when a minor is needing to consent, this is anyone under the age of 18. They legally have to contact the next of kin, and it's actually called informed permission at that point. But if the patient is emancipated, pregnant, or married, they can give consent themselves. But if not, then they obviously need to contact the next of kin, and if they have no next of kin, then the physician would go to a judge. Now, when someone is incompetent and they need to obtain consent, they would also go to next of kin. If the physician is unsure, they will call a psychiatrist to determine whether or not this patient was competent or incompetent. Now, if they have to call next of kin for any reason, the next of kin would be spouses, adult children, guardians, parents, adult siblings, adult grandchildren, or even a grandparent. Now, there's something called therapeutic privilege that a physician can invoke, and this is when a physician will knowingly withhold information to protect the patient. Sometimes this is seen as unethical, but it can be done to protect the patients. So if a patient wants to refuse or revoke treatment, they can do so at any time. They don't need a reason, but if they say they don't want the treatment anymore, then the physician has to stop. In the case of an emergency, the physician can only treat the patient to make them stable. Once they're stabilized, if the patient is awake, they can consent to further treatment. If they are not awake, then they have to, the next of kin has to be contacted. There are reasons that you would not need consent, and this would be if there's a court order, or if a law enforcement officer needs something like blood alcohol level or something like that because there was a crime. Crimes that would be brought against the physician if there was no consent would be battery, negligence, and even malpractice. Battery and negligence kind of go hand in hand. They're both intentional touching of a patient when there is no consent, but under negligence, they have the right to be to monetary privileges, which would be things like pain and suffering, damages, things like that. And malpractice would be if the information was not explained thoroughly enough and an injury occurred. Now, to relate this back to healthcare administration, I want to talk about the risk manager's job. Now, if there is a case brought to a facility with battery or negligence, the first thing they will look at is informed consent. This is because this is the baseline for it. But the risk manager's job is to protect the physicians and the facility. If any case is brought, the risk manager would look at every single piece of document that they could to see if there was anything missed or their best course of action. Now, if something does happen, they will create guidelines to make sure that nothing like this would happen again. And if it's not inside the facility, they can look outside the facility to try and prevent anything from happening before the fact of anything happening. So the importance of informed consent is undeniable, and risk managers work very hard to improve the facility's position. So in the risk manager's position, you would just need to try to look at all aspects, looks outside the facility and everything to make sure that nothing like this would happen, or try and prevent it from happening, even though sometimes it can happen no matter what. But the best thing to do is to be prepared. Thank you.